For this segment of the demonstration, I'll be teaching you how to mix insulins. First, you want to make sure you have all of your supplies. We have our syringe, we have our alcohol wipes, we have our regular or clear insulin, and we have our cloudy or NPH insulin. Anytime you're using an NPH or cloudy insulin, you want to make sure that it's completely mixed together. So instead of shaking it, you never want to shake it. You're going to just roll it in your palms like so for about 20 seconds or until it's completely dissolved. And it'll have a cloudy appearance like so. Now we'll take our alcohol wipe and wipe the tops of our containers like so. We'll go ahead and take the cap off of our needle. And for this demonstration, we'll be using 6 units of clear and 4 units of cloudy. So we're going to go ahead and draw up our cloudy, the amount of air that would be the same or equivalent to the insulin injection. So we're going to do 4 units of air and insert it into the cloudy container like this. Okay, and then just remove that. And now we're going to go ahead and draw up the 6 units of air to go into our clear insulin. Okay, once you have your air inserted into your clear insulin, you'll go ahead and aspirate your 6 units of insulin just by pulling the plunger back. Okay, we have our 6 units here, and then we'll aspirate the 4 units of our cloudy insulin. And as you can see, we have 10 units. You're going to want to go ahead and recap using a one-handed recap motion, just by sliding the cap on like this. There you go. And you're ready to administer your insulin shot. And you want to make sure you do this within 5 minutes of mixing.
I'm going to demonstrate how to use an insulin pen. First thing you do is locate your pen, make sure it has not expired, and the needle for your pen. Wash your hands, which I've already taken care of. Remove the cap from your pen. Remove the protective covering from your needle. Insert your pen and twist gently until it's secured and remove. Now, if you have insulin that is long acting, it would need to be mixed. Place it between your hands and roll about 20 times gently until it looks cloudy. Remove the protective cap from the needle. At this time, it will need to be primed, and that is to make sure that you will inject insulin to your patient and not air. You dial it to 2, you push, then it'll go back to 0. You change it or dial it to the amount prescribed for your patient. Now you recap. And now you're ready to inject your patient.
This part of the demonstration, I will be showing the common injection sites. One of the more common injection sites is the stomach. Holding the stomach, pinching it, and injecting the needle. There's 2 parts of the stomach that can be given the injection site. Never wanting to give an injection site at least 2 inches around the belly button. Going around the back, stopping where the spinal cord is, and never going up in the middle of the back nor the top of the back. Coming around, getting the back of the arm, never in the front of the arm through this section. And it's almost in a graph like when you rotate your regions to give your injections. Going down your leg, the upper thigh, there's almost a 45-degree angle that you cannot give the injection inside, never in your private region. The reason for rotating the sites is to decrease irritation to the tissue and increase absorption. You are encouraged to keep a daily record of injection sites to help remember which sites have been used and avoid erratic absorption.
I will demonstrate how to inject the insulin using a syringe. Now, first clean the area of skin you're going to be injecting with an alcohol pad. Okay. After cleaning the skin, pinch the area of skin that you're going to be using before you inject the needle. Remove the cap. Always inject the insulin or the syringe at a 90-degree angle, like so. Okay. After you inject the insulin, push the plunger all the way down, like so. All right. Release the pinch, counting to 5. 1, 2, 3, 4, 5. Remove the needle. Recapping the needle, like so. Do not rub the site and dispose of the insulin needle properly. Okay. Now we'll demonstrate how to inject insulin using an insulin pen. Okay. Now, the order prescribed is 4 units, so therefore you dial up to 4. Remembering to hold the insulin pen in the arm for 4 seconds, because that's the amount you dial. First, remove the cap and use an alcohol-based swab. Rub with alcohol. Pinch the skin. Hold at a 90-degree angle. Inject the insulin. Remove the pinch. Here you go. 1, 2, 3, 4, because that's the amount of units. Remove the pen. Do not rub or irritate. Recap the needle and dispose of properly.